Welcome to the CSAE Research Podcasts, a series of conversations about projects taking place at the Center for the Study of African Economies at the University of Oxford. So I'm Stefan Dercon, I'm the director of the CSAE and I'm a professor of economic policy at the Department of Economics in the Blavatnik School of Government. This year, the Econometrica Society awarded the 2024 Frisch Medal Award for the best applied empirical or theoretical paper published in Econometrica in the last 4 calendar years to Dennis Egger, Johannes Haushofer, Ted Miguel, Paul Niehaus, and Michael Walker for their paper General Equilibrium Effects of Cash Transfers, Experimental Evidence from Kenya. And it's a great pleasure for me to be able to talk today to Dennis, who is an associate professor at the Department of Economics here at Oxford and also linked to the CSAE. And we're going to discuss the research behind the award. So welcome, Dennis.
Yeah, thanks very much. I'm looking forward to this.
So, Dennis, this is quite an amazing achievement to get an award like this, awarded only every 4 years for the best paper in Econometrica. Clearly, it's going to be really interesting, I think, for our listeners to understand a bit more about this research. And maybe just to simply start with this is, what was the question? What was the question you and your team set out to answer?
Yeah, thanks, Stefan. So we started sort of at a time when sort of research on cash transfers, unconditional cash transfers in particular, which is basically cash given to poor households with no strings attached. So they can decide what they want to do with it. Different households will have different priorities, had sort of been growing. And there had been a set of RCTs looking at the impacts of these cash transfers on recipient households. So how do they spend the money? Do they spend it on wise things? Do they invest it in things that will generate income down the line? There were all kinds of worries around potentially poor households not being able to use the money effectively. And those had sort of been dismissed at the time when we entered the field. But what was not clear is sort of whether these effects stop at the people that you give the money to, or whether these effects ripple out and sort of affect their neighbors, the local communities, local prices, and economy sort of more broadly. This is what we call the general equilibrium effects, which are in the title of the paper. And in a way, it's a sort of natural question as an economist to ask, because cash by nature only has positive benefits for the recipients if they spend it. And they need a counterparty to spend that cash, and presumably the counterparty will benefit in some way, shape, or form from receiving that cash. And sort of we went out to try to sort of estimate rigorously these spillover effects on neighbors, local economy, prices, enterprises and firms in the local area. And this is important because overall, we care not only what happens to recipients, but we care what happens to welfare of everybody in a community, to local economies, both in the short and in the long run, and that's sort of why we started to address that.
Right. So tell us a little bit about, how do you go about answering a big question like this? Normally, micro people, they look at micro impacts on households, on firms, and then macro people look at big things. So this sounds to me like a micro person trying to do something at the macro scale.
Yeah, exactly. And this is sort of, partly why I got super excited about this paper from the start is that really we are trying to merge here some of the tools and methods that we use in microeconomics with the sort of concepts and effects and questions that macroeconomists are asking. We're really sort of doing macroeconomics, but with an RCT and with our own really rich microdata collection. And I'm going to sort of talk a little bit now about how exactly did we do this. So the first thing, and you've sort of already alluded to this, is that you need really extensive measurement. Right. So you need data not just on recipient households, but also on households that were ineligible. So you need a sort of full set of representative household surveys that map or capture the entire economy in the area that you're studying. But you also need data on firms, enterprises, so a representative set of all the firms and enterprises operating in these villages and economies. And you need data on prices, of labor, such as wages, but also prices of output goods that you can find in the markets. And so really, to be able to do this, we had to construct our own measures of GDP, basically. So we had to be like a national statistical office, but with our own survey data, reconstruct what they would do to sort of capture broad aggregate economic activity in these villages. The second thing, of course, is that you then need some variation, some identifying variation. So how do you actually estimate the effects of this? And we did a randomized control trial, which is sort of very established in the micro and development tradition, but with a twist. So the problem with a normal RCT is that, you have a randomly assigned treatment group and a randomly assigned control group. But when you are worried about spillovers, about things that might be changing in this entire economy, then your control group could actually also be affected by the treatment. And so when you're now comparing treated and control groups, if the control group is also affected, you don't have a valid counterfactual. You don't have a valid measure of what would have happened to the treated group in the absence of treatment. And in a study that specifically tries to get at these spillover effects, that's obviously no good, right? And so the innovation methodologically there is to have two levels of randomization. So yes, you randomly select villages that receive cash, but then you also, at a higher level of aggregation, which in our case was the sublocation, this is a groups of 10 to 15 villages, you also have higher and lower saturation of cash. So in some regions, 2/3 of villages were randomly selected to receive cash. In other regions, 1/3 of villages only. And what that creates is sort of now at the local level, variation in the intensity or in the saturation of cash flowing into these local economies. And now you can compare even control households in high versus low saturation areas, where in some places, a lot of their neighbors got cash, and in other places, fewer of their neighbors got cash. And to the extent that you find any differences between those households, because treatment was randomly assigned, those differences would have to be because of these spillovers. So the households with more neighbors treated within sort of 1, 2, 3 kilometers around them, if they're doing differently from the households with fewer neighbors treated, that would have to be as a result of these cash transfers. And lastly, of course, you can only do this if you have an implementing partner. So if you have somebody that actually does provide these cash transfers and is willing to sort of, conduct this study with you and learn from them. And we were working with the NGO GiveDirectly, who basically the business model of the NGO is to provide unconditional cash transfers to poor households. At the time, they were working in Kenya. The region that we were working in is Siaya County, and that was sort of selected because it's a relatively poor part of Kenya, relatively densely populated. And therefore sort of super important and also in some sense representative location to study these kind of impacts. And yeah, those are sort of the ingredients that you start with, and then you go and do it.
Yeah, I just want to follow up a little bit on how you did it, and before we get to these results. So to pick up an effect, when normally cash transfer programs are happening, they give $10, $20 a month, or something relatively small amounts of money. But also this design that you describe. So you must be very rich, or at least the people you worked with. This must be a massive study. Can you just give me a sense of the scale and the kind of how big do you need to be able to do this to be able to actually see impacts here?
Yeah, thanks. I mean, that's one part I sort of maybe didn't stress enough. You're right. To have not just effects at the household level, but effects at the economy level that you can actually measure and observe and pick up with, the statistical methods and tools that we have, the study needs a lot of variation in cash transfers. In our setting, that was true. First, households who were recipients of this received $1,000 or about $2,000 in PPP terms. That is something like 75 or 80% of average annual household income. So it's a very large transfer, and this is sort of typical of how GiveDirectly operates. It's not sort of small piecemeal transfers. It's a one-time over 3 tranches paid out large lump sum cash transfer that's quite transformative or expected to have quite big effects at the household level. But it was also large in terms of the saturation, right? We just talked about this. In high saturation areas, 2/3 of villages received transfers. And in treated villages, the transfers were something like 15% of village level GDP. This is a massive stimulus. If you compare this to sort of tax rebates or other types of studies that people do in macroeconomics, these often are sort of 2, 3, 4% of course, national GDP in their case, but they're sort of locally not as intense as this study. And so, yes, you're right. If you're going after big effects, you need a big treatment. You need a lot of variation in sort of your treatment at the sort of geographical scale that is relevant for your study. Unfortunately, we were able to do this with GiveDirectly.
So okay, that's then quite interesting, of course, because now when you describe it, how big this whole intervention is, I can imagine that your priors would have been, well, this could have had quite big effects on prices, big effects on wages. You would have probably a lot of people expecting to find that this is really disrupting a lot of what's going on there, and yeah, and so what did you find?
Yeah, so I'll sort of walk you through the results sort of as we do in the paper, starting with the recipients. So we're going to look at effects first just on people who received the cash. And there we sort of followed in a long line of research. Hundreds, I think by now, of RCTs have shown similar results. So recipients, of course, benefit. And in this setting, they basically spend all of it over the first sort of year and a half. All of the cash is spent. And that's not necessarily because recipients aren't saving. Even when they're saving, they're purchasing things like livestock or durables, which then will have benefits for long term to come. But they're still market transactions. So there's still sort of purchases in the local market where the money then ends up in somebody else's hands. And this is sort of going to turn out to be really, really important. So we estimate here a marginal propensity to consume of about 0.9 over the first year and a half, 2 years, which, yeah, basically means they spent everything. And what also turns out to be important is that about 75% of that spending was local. So is on goods that are locally produced and locally sourced. A lot of it is food. Others are sort of local services, local manufacturing, and so on. So a lot of that money in the next round ends up in the hands of somebody else, of some business owner who locally sells these products. I just want to say one quick thing again to flag. We didn't find any of these sort of worrying potential negative impacts on purchases of tobacco or alcohol or gambling that some people had been worried about. We don't find that at all. So people spend more on food, they improve their homes, they send their kids to school for a bit longer, they start businesses. As you would expect, different households have different priorities, but generally it looks like a relatively meaningful, sensible, positive change in recipients' people's lives. Now we're sort of going to flow or follow this money as it sort of flows through the economy. So we're now going to turn to what we found on the enterprise side. So reassuringly, a year and a half later, recipients had 15% higher consumption, $350 per year. We find exactly the same increase in local revenue, $350 increases in revenue on average per household for local businesses. And that's just to say that sort of our measurement worked, in the sense that what we're able to capture in terms of increased spending from our household surveys, we're also able to capture as increased income for local firms. So local firms' output expands. And one thing that we're gonna come back to, and that's really interesting, is it expanded without them really hiring any additional workers or purchasing all that much more in terms of machines or sort of inventories. And so what sort of seemed to happen is that sort of these firms were able to increase production by reducing their slack or idle capacity. and therefore sell more. Corresponding to that, we also don't really find them increasing their prices. So on average, there was inflation, and we, again, just to sort of highlight the richness of our data, we collected data for something like 100 products in 60 markets over 30 years and up to 3 price quotes. So there's like 500,000 measures of prices underlying this. And on average over this period, prices rose in treated areas by 0.2%. Compare this to the 15% increase in spending, you can already see that basically almost all of the gains that we see in terms of spending were real gains. People were actually doing better. They didn't spend more just because prices have been going up. So we find very little inflation overall. Now, how does that now affect non-recipient households? So many of these businesses who now have higher revenues and higher profits are not owned by recipient households, right? There are people are owned by neighbors or people who are in a control group, yet they still benefit from having this increased demand for their products. So they're able to pay higher wages. We find a pretty sizable increase in wages, and we find a pretty sizable increase in profits. And some of these increases in wages and profits will go to non-recipients. And, strikingly, if you look a year and a half after the transfers, we had recipients' consumption go up by 13 or 15%. Non-recipients' increase in consumption was exactly the same, 13 or 15%, a year and a half later. And that really sort of highlights this idea of a sort of multiplier effect. So recipients spend the money, local businesses see an increase in their demand. They're able to pay higher profits and higher wages to their workers and their owners. These owners now have higher incomes, which they spend again in the local market, raising further local demand, which then sort of trickles back to the owners and so on. And so as the money starts flowing around the economy, you have this typical Keynesian idea of a multiplier where sort of the tide lifts all boat. A year and a half later, everybody seemed to have benefited roughly equally from this large injection of cash. What we then try to do is, sort of tie this all together and summarize this in one multiplier number, right? Because, this is sort of the classic Keynesian idea of how much extra economic output you get for every $1 that you transferred into this economy. And what we find is that this multiplier in our setting is 2.5 on average, and we measure this in 2 different ways. So on the expenditure side, you can see what are all the expenditures going on in the economy, and on the income side, what are all the sources of income? I've already mentioned wages and profits, but there's also rental payments, and how much does GDP measured in these 2 different ways go up as a result of sort of injecting $1 into these economies, and the result is 2.5. So for every dollar transferred, there's 2.5 times more than that generated in local economic activity. And that is, net of any price increases. So in real terms, that's a pretty large multiplier. And it's larger in particular than many of these studies in high income or sort of richer countries such as the US or Europe find in response to cash rebates or military spending, for example. And it's certainly something that, surprised us. But it's super encouraging because it sort of shows that, if you just took the direct benefits of cash that we had already measured in RCTs before, you would significantly underestimate the total benefit of these programs because you're missing, another 1.5 times as much benefits that accrue to people who are the neighbors, who are local business owners, and who also shop in these markets.
So, okay, that's pretty cool results, clearly. So maybe tell us a little bit what you think this now means. Are you saying, look, if we're now going to do this over the whole of Kenya, we would see these effects. We should be doing this. I mean, what do you draw as conclusions for broadly defined policy of NGOs, of philanthropists, of governments? So what does it tell you? What are you confident about in terms of what it tells you?
Yeah. So I think the first point is just to reiterate what I just said, what seems clear to me is that if you want to assess how effective cash transfers are, looking at the direct effects on recipients only is going to significantly underestimate the total positive benefits.
Yeah.
So in a setting like ours, you're going to only have 40% of the full effect if you're doing that. And so you're going to want to sort of reassess maybe your evaluation of how good cash is relative to other types of interventions that you could do upwards, because these spillovers are positive, and these sort of concerns around negative spillovers, including on prices. One thing I haven't mentioned is on sort of potential negative psychological spillovers, that people now perceive that there's inequality in the economy, and they're unhappy about this. We also don't see this at all. So even the non-recipients, if anything, have no change in sort of reported psychological well-being, if anything, slightly positive. So all these sort of potential negative concerns around negative spillovers aren't borne out. On the contrary, the sort of maybe the positive spillovers are larger than we may have expected. So it's going to presumably sort of assess your evaluation of cash upwards by a little bit. I'd want to be careful, though, to say, look, the multiplier is going to be 2.5 everywhere, and these negative effects are never going to show up. And now I'm going to sort of get a little bit like nerdy about what's really underlying this. And really the aggregate impact of this cash depends on this sort of low observed inflation, even though output in the local economy increased by a lot. It's what we would call the sort of supply elasticity. So it just seems to be true that in this type of setting, the supply in the local economy is able to match that increased demand. And that's a substantial increase in demand, right? Of like 15, 20% of GDP without local firms having to raise prices. And that's really sort of the big puzzle that was raised by the study, is why is it that economies like this are able to do that? And when I say economies like this, I mean, a vast share, or probably a majority of economies in this world look relatively similar to this, relatively rural, dominated by agriculture, with local weekly markets. That is prevalent all over sub-Saharan Africa, South Asia, many other developing country settings. And presumably some of these findings that we have would also translate to there. And this sort of leads us a little bit into sort of ongoing work of how can we explain why that happened. And so one idea that we have is, let's look at how firms actually did it. And as I already mentioned, they didn't really hire any more workers. They didn't really invest and sort of purchase many new machines, yet they were able to sort of increase output by 30, 40% without doing so. Clearly, a part of it is increased intermediates. So, they purchase the inputs that they need for their products. These are imported typically, from Mombasa port or from Uganda in our setting. But we sort of show that this is a small part of the total effect. A big part of the effect is just coming from increased utilization or increased output with the same number of workers and machines. And this in economics terms is a productivity increase. So what we think is going on is that there's sort of significant underutilization or slack in these economies in normal times. And one reason why this might be is, just to give you a statistic, 90% of firms in our markets, and this is the universe of all firms, are one-person firms. And anyone who's been in these kind of settings or works in development economics knows that this is super prevalent everywhere. You have a lot of these micro enterprises. And what we think might be going on is that basically these firms face a sort of integer constraint. And that is the fact that ideally maybe, they only have enough demand to be there 3 or 4 hours in the day, but they have to go to the market and man the shop, quote unquote, for the whole market day. And now if you have sort of, 20% more customers, you work 5 hours instead of 4 hours, and you wait a little less. And so you're able to sort of serve those customers without having to sort of hire a second worker. A similar sort of logic applies with the sort of most predominant form of manufacturing here, which is grain milling. Every village has a grain mill. That grain mill may run 4 hours a day. Now, with more people bringing more grain to be milled, it runs 5, 6 hours a day, but we didn't really need a new machine um, to sort of service the additional demand. And that sort of will tell you now a little bit about how generalizable these effects are. So in sort of other settings, maybe where you don't have so much underutilization, where firms are much more close to capacity, where there's more larger firms, say, for example, urban, highly densely populated Nairobi, potentially you'd find smaller multiplier effects. What's sort of nice is that since we published this paper, a lot of other papers have come out using different methodologies, trying to estimate multipliers across different countries. And the pattern seems to hold that you do find larger multipliers in developing country settings more broadly. And this is true in Mexico and in Brazil and in the Philippines and in other sub-Saharan African countries. So we are capturing here something really truly sort of different about developing country settings that maybe is more generalizable than we initially thought. And so just sort of long-winded answer to say, probably you should also think that sort of direct cash transfers, social protection programs, things like that would have bigger multipliers in developing countries more broadly, even though at some point, potentially, you know, they'll start to become a little bit smaller as in our setting. And inflation will or potentially might kick in if you make them large enough.
Yeah. So it's interesting thing that, of course, you get here and you emphasize also this, you know, the relative rural nature of these settings and the underutilization of capacity. You alluded to what is effectively a bit of the trade balance in these areas. So that is a little bit more inputs of intermediate inputs coming in, but you say it's relatively small. So one of the things, because you know it could be very tempting for a government in Kenya saying, well, clearly, you know, Keynesianism is back. Let's do a lot of consumption, government consumption expenditure. But the concern clearly has to be at some point also something to do with what's happening here with your trade balance. So maybe the effects are not inflationary directly, but there's something here about, you know, if you do it in an urban area, you'll have to get these inputs from somewhere. And then, you know, there's maybe something about other effects here as well. I don't know. Does that seem to make sense?
Yeah, I mean, I think you're really pushing the research and the envelope in a really interesting direction. Even though this was, you know, by many measures, one of the largest, if not the largest, cash transfer RCT, it was still a small area in rural Kenya, less than 1% of national Kenyan GDP. And it's certainly not comparable to sort of a large billion-dollar aid program going or the central bank, you know, just printing money to pay for the fiscal debt of the country. So I'm not going to try to say that, you know, you should translate what we found to these types of programs, which, you know, much other research has shown may not necessarily make sense.
Yeah.
But I agree that, you know, a big difference between this sort of locally big, but like nationally small program and a nationally big program is this idea of the trade balance. If you print money or get not just rural households, but urban households or everybody in Kenya to want to consume more mattresses, this is sort of an example you could think, and there's no mattress production in Kenya, you know, whoever is importing mattresses is going to feel super happy. And also you clearly want to start looking at what happens to the exchange rate. Might this lead to a sort of Dutch disease kind of idea where the exchange rate appreciates and then all imports are becoming more expensive? At some point, there must be a supply constraint, right? The fact that local production here is sort of relatively unconstrained because of this idle capacity leads to these large multipliers. But this is clearly not true for all types of goods. Imports are a particular type of good, but also sort of local manufacturing. At some point, you know, if everybody buys more of the limited manufacturing that Kenya does, prices may have to rise. And so when we sort of, you know, take this and think about the future and scaling this up even bigger, those are the questions that are top of my mind. Like what happens in larger firms? What happens to supply chains, imports, exchange rates, you know, tax revenues, these types of things that clearly governments and sort of larger policies would care about. And maybe we get a chance to talk a little bit about how we would tackle that. But that's then sort of the next step in this bringing micro to the macro.
So this is actually really interesting, because what you actually are saying is here, um, the small can be bigger than maybe we sometimes have assumed. This is quite a big intervention, yes, in a relatively local area, but probably bigger than many of these interventions we
Yeah,
typically do with transfer schemes. And so it's about, where is that sweet spot? How big can you go? It probably talks to something that you know you are working in a pretty poor area. Consumption patterns of relatively poor people is definitely less import dependent, is less requiring some of these large firms and the frontier type of things. Their basic needs are still very basic.
yeah,
So there's something quite encouraging here, that actually you can also probably think about um, maybe scaling these things for really poor people.
yeah,
May not have these problematic effects, but it is clearly you want to be careful with these Dutch disease kind effects once you're going to go whole national and so on. So
yeah,
there's a lot of interesting angles here. So
yeah. Can
so
I add to that? I think
yes,
it's a really interesting question around how to target these programs, right? So people, in my view, sort of think about targeting in two different ways, right? One is this sort of individual level. Let's try to find the most deserving, the poorest, the people who will make the most use of this cash at the individual level. Should we target it at sort of maybe pregnant women, because this might then reduce child mortality? So that's just sort of the targeting at the individual level. And microeconomists have thought very, very deeply about this, and there's lots of great papers around this. And it's clearly there's heterogeneous impacts for different types of households, and there's a lot to be gained from this type of targeting. But if you're a macroeconomist, and if you're sitting at a sort of budget office or at the sort of treasury of whichever country, that's part of what you think about. But then the other thing is, what you think about is targeting at the macro level. Typically, you want to target sectors where there is a lot of underutilization, that have a lot of slack. Maybe you want, in after our findings, target rural areas where a lot of slack is present. So just like with a stimulus package in a recession, maybe in developing countries, they will have to sort of also start thinking about, well, where do we have this underutilized capacity? There's many small entrepreneurs who can just basically costlessly, without having to raise prices, increase the services that they sell. And sort of one direction that I'm super interested in as well is, how can we operationalize this, right? How can we make this sort of something that policymakers can take into account when they design stimulus packages or tax rebates or sort of social protection programs that target not only at the individual, but also maybe at the regional or economy level, both over time and over space.
yeah. But it's interesting what you now just said, because in some sense, what you could probably say is that these poverty traps that these people may be in are spatial. And it doesn't really matter who gets the stimulus here, because they are spatial. So if we don't need to target the poorest people in that particular area, because the multipliers work through the system. There's a way of looking at here, but it goes
Yeah,
back to the kind of the spatial nature of it, and of course that then links back to other growth theories that talk about the spatial externalities, and that growth is all about these spatial externalities. And so, in some sense, with the kind of size of multiplier, it doesn't matter too much who you actually targeted here. You get that. Is that a fair interpretation?
Um, I wouldn't go so far, but yeah, certainly it's like it's a counterpoint to saying, the people that you don't target are gonna end up with nothing or even be aggrieved. No, I mean they'll certainly benefit from this large aggregate economic effect. It is still true that some people spend it on different things, and households are different in the way they benefit. One thing, for example, and this is the only slight sort of potential downside of what we found, is that the spillovers are a bit more likely to go to relatively richer. And when I say relatively richer, these are still very poor households, but it's the local business owners. It's people who are active in the market, that that benefit the most. And that makes sense because the spillovers do operate as we document through these market interactions, purchases and local sales of firms. They don't operate through things that we might have expected, like people sharing the money with their relatives directly. We don't find any evidence of that. So the spillovers are really market-based. And so whoever is able to sort of be there and have a business is going to benefit a little bit more from that. But it's certainly true. Yes, it's coming back to this tide that lifts all boats. When we do this welfare analysis in sort of new, more structural work, we find that absolutely every village on average is better off. So even the control villages benefited on net, and there's not a single one that sort of might have been hurt by the program.
So with all you know about these villages now, is there anything that exposed you now think, I wish we had done this a bit differently, or we wish we had more data on something? I'm just curious, how would you improve your own study if you got the chance?
Oh, that's a great question. So I mean, it was already like a heroic data collection effort, but I think one thing that I wish we had done differently, and that I am actually now doing differently in some follow-on studies, is to really carefully measure not just baseline and then a year and a half later end line, but to sort of do monthly, even if they're shorter, even if they're with a subsample, sort of surveys of what people do as the money rolls out, because the bulk of the decisions and the spending are happening right when they get the big transfer. And sort of a year later, people might not recall it as well. Much of our recall periods in these consumption surveys are 1 month or 7 days. And so a lot of this has already been has already happened and is outside of our measurement. What we do in the paper in the end is we use comparable studies to estimate what would have happened over this 3 to 6 month period that we missed and sort of fill that in. We think that's relatively plausible because the GiveDirectly program has not changed very much, and these areas are very similar. But in the future, I might have built that into this study and sort of maybe do a shorter survey, but more frequently, and not just the one big end line. And this is, I think, something that everybody should think about this doing RCTs. What is the right time to measure outcomes? Does it make sense to measure the dynamics of it, not just, a one-time, this is now the effect? Because clearly we care about the whole trajectory. Just to sort of flag, we're in the field again. We just started last month, a 10-year follow-up. We did a 5 to 7 year follow-up as well. So really to understand what this is doing, not just at the individual level, but sort of does this transform local economies in the longer term, which is what we're ultimately interested in. You also want to be doing these long run follow-ups. This matters, not just in terms of our understanding of these economies and the research, but also in terms of our evaluation of these types of programs, right? If effects persist for 10 years, that's a very different type of positive impact than if it fades away after 2. And so, stay tuned for updates here on what's happening. We also sort of ex post started measuring a bit more of what happens to fertility decisions, child mortality, children's outcomes. So this is sort of the intergenerational transmission of the benefits, which turn out to be substantial. So in ongoing work, we find substantial reductions in child mortality for households which had a pregnancy in the sort of in utero period or 2 years after the cash transfers. And that, of course, is another massive benefit in terms of lives saved that you cannot measure in terms of, a GDP multiplier, but that may be just as important or even more important if we think about the net benefit. And so, in hindsight, I may have wanted to do a little bit more in real time. The good thing is that we could go back and did a full census of all households, all of the birth histories over the last 10 years, capturing over 120,000 births and their outcomes. And we did verbal autopsies to sort of in great detail measure what changed and how does cash lead to these sort of transformative child health outcomes. Again, stay tuned. The working paper should be coming out soon here. But there's sort of more angles to this than just the sort of local macroeconomy angle. And we're still following up on those.
So some of the people listening, well, besides being genuinely jealous of the amazing work you've been doing, and you fully deserve all the accolades and and the awards that you got for it. Um, some of the people listening may not think they would have access to the kind of resources, the kind of facilities, the kind of teams. So if you're interested in this kind of work, what are the kind of questions that they should be looking at in this whole field that maybe sheds light on side questions and so on when you don't have all this access to resources? You know what are the
Yeah.
kind of things that people could work on and explore? What are the kind of things that are thrown up by this kind of research that maybe with simpler, cheaper studies could be followed up on by others?
Yeah. I mean, yes, I agree. And you know, full transparency, I joined this project as a graduate student myself, and did not sort of myself have all these resources available as well. These are very large studies that require a lot of, you know, financial and time resources and big teams to collect all this type of data. They require really good implementing partners that, you know, are trustworthy, that implement the design as intended. And so they're not easy studies to pull off. And just sort of as a word of caution also, I see a lot of now people doing smaller RCTs wanting to also look at spillover effects. And I just would like to say that, you know, having thought about this quite a bit and wanted to do this in follow-on studies too, do your power calculations really carefully. You do need a lot of variation in treatment intensity and a really big treatment effect. So just to give you an example, suppose the multiplier is 2 and you give cash to 10% of people in a local economy. The 90% of people who did not get it would have to have a 9 times smaller effect than the direct effect. And to be able to be powered for that, you need 81 times as much sample among the non-recipients as you do for the recipients. So just to sort of say, like, think through it carefully. That said, is, you know, you can't, it doesn't mean that, you know, every study has to be this big. The first thing is all of our data is online, and we're super happy to make that publicly available, and other people can sort of dig and look into that data. The other thing is you could combine multiple other studies with, you know, online data repositories and combine multiple studies in a meta-analysis to get further insights at potentially a larger scale where each individual study is underpowered. The third thing is not everything needs to be an RCT. There's other great strategies such as difference in differences, or sort of that people have been using convincingly for many years. So what I'm saying is some of the follow-up studies, for example, on multipliers in Brazil, used your traditional shift share approach of increases in social security spending at the national level, which differentially impacted different regions because they had different poverty levels to start with, and use that to look at then, you know, regional level GDPs. And those studies don't require all these big resources. So think creatively about using sort of natural variation that happens from changes in government policy and big influxes of donor money, for example, and you can look at these things too. And lastly, I think, you know, I've tried to give a little bit of a flavor of the open questions of, like, why is supply so elastic? Why is there this underutilization? Why are there so many small firms? Answers to all of these questions will help understand and put into context, you know, the big, like, why was the multiplier so big? And also will help inform policy in terms of how can we overcome, or how can we make the multiplier as big as it could be? And those are sort of mechanisms questions which you can get at with sort of smaller scale data collections or smaller RCTs. And I would love to see more work in this direction.
This is great. Okay, so I think this has been a great conversation, and I just would want to thank you very much, Dennis, for your time and your enthusiastic explanations of all the things related to the research. I just want to refer back to the paper we were discussing. It's the paper by Dennis, by Johanna Zaushofer, Ted Miguel, Paul Niehaus, and Michael Walker, General Equilibrium Effects of Cash Transfers, Experimental Evidence from Kenya, published in Econometrica. It's been a great pleasure to talk to you, and look forward to see the next papers related to all this research. Thank you very much, Dennis.
Yeah, thanks, Stefan, for all the great questions and the discussion. Appreciate it.
Thank you.